With long-term care facilities, the hotspots for COVID-19 infections, thousands of seniors are in danger across South Florida. The governor has dispatched the National Guard to oversee these homes to try and stop the spread.
And we are now hearing from an administrator of one local facility about what needs to be done before they can even think of reopening. And Local 10's Glenna Milberg is live with a glimpse inside one of those facilities. Glenna.
Where the National Guard will be tomorrow, Christy, Louie, and the word is testing, widespread and continuous. That is what we hear from every administrator. The people who protect or try to, all of these people are the most vulnerable, the elderly and the infirm who live in these facilities who are dying of COVID-19 at an alarming rate, and they're being told the kind of testing they need is just not available.
The Archdiocese was informing families of COVID cases in its long-term care facilities long before the state made that list public.
That we set it up for them for tomorrow.
This is where the National Guard strike team plans to test tomorrow the staff of St. Anne's nursing home, but only 10 of its residents.
So for us, we're going to require full-scale testing every 14 days. So this is not just once every 30 days. This is a full testing of all staff and all residents every 14 days.
The capacity for that kind of testing and lab work does not exist anywhere in the state at the moment. What does exist, more than 300 long-term care facilities in Florida where COVID-19 has sickened and killed the most vulnerable Floridians. Just overnight, they account for 56 more cases and 12 more deaths. Hampton Court, for example, had its first positive that it knows of.
We need the National Guard. We need them to come and test our patients and our staff.
With long-term care, the COVID-19 crisis epicenter, all closed to visitors since last month, that means the elderly and infirm stay isolated from the comfort and embrace of family and visitors.
I just can't envision doing this for another 12 months and not allowing a family member in to see their loved one.
That 12-month reference is talking about a vaccine, that until there is a vaccine, that these people will have to remain isolated and closed off to visitors to keep them healthy. This long-term facility issue is clearly the state's biggest health issue when it comes to COVID-19. I have a lot of information and interviews and charts and graphs on my social media. I would love it if you followed me there. My handle is @Glenna, WPLG, on Twitter, on Instagram, on Facebook as well, and you can reach out with any of your questions there as well. I'm Glenna Milberg, live in Southwest Miami-Dade today, Local 10 News.